And the fact that we collect voluminous amounts of data in this field, oh my heavens. And a group of folks, again, it was in the early 90s, petitioned the Bureau and really got them to understand that for a small amount of money, they could answer a whole bunch of questions with the data we'd already spent a lot of money collecting. Because before, you couldn't get that kind of research funded. Well, what do you mean you're going to you're going to analyze data that's already been collected? Well, what about the new data? We don't need any more data. We're drowning in it. So that was a real sea change. So the MCH Bureau really shifted what they would fund, and they started funding more applied and translational research, more of these small grants to use the data that's already there, more systems approaches, the whole systems development initiatives that they designed in the 90s to help states actually start building systems and encouraging researchers to support it with research. And then you even saw the NIH kind of say, oh, well, wait, there's more going on out there, and the whole roadmap and prevention and all sorts of other. And then you had other foundations kind of stepping up and trying to fill that research gap, the Robert Wood Johnson Foundation and Pew and Kellogg and others saying, you know what, we really have to think about research in a different way about, children aren't, one, they're not little adults, and two, it's not enough to just get them to get thee to a healthcare provider. There's all these other, in fact, that's often the least contributor to their overall health. And then of course the big research breakthrough, if you will, which again is one of those things that we've always known intuitively, is that what happens to children or fetuses or women before they conceive affects the life of that child throughout their whole life. That's one of those obvious duh kind of things. But now we have a growing body of research evidence to support it with hard, even biomedical data to support the fact that this hypothesis is actually true. And so, I love to say that, we kind of went from, if you think about, you're creating a health department so that you can have an MCH program, sort of MCH being king, right, to MCH can't find it anywhere. Or even when I ran an MCH division, I used to love to go to the budget fights. We would all go and present our budget request to the commissioner, and then she'd decide what she was going to put forward. And they'd say, oh, well, I don't even know why you're here. You're just MCH. Like, I didn't need any money, or I didn't, And so that's why I was just MCH. Then there was no MCH. Well, now it's like, hey, hello, guess what? I'm everything. Because if you don't do this right, oh, you're just chronic disease. Who needs you? If you give me all the money, right? So it's sort of been this interesting, kind of ebbs and flows. And I'd like to think that this whole new focus on life course or fetal origins or, all the different terms people use will really reinvigorate this field, because I feel like it's been a little kind of sleepy for a while.